Good evening, and thank you very much for joining us here in the British Medical Association Library. The aim of this broadcast is to air some of the issues which have been raised in the government's white paper, Equity and Excellence, Liberating the NHS. It, of course, sets out plans for a new commissioning structure led by doctors, but it also tackles wider issues such as education and training, public health, commercialisation, and also staff working conditions. The British Medical Association has already responded formally to the white paper, but with the government's health bill soon to be published and also their formal response, ideas surrounding the white paper are going to continue to evolve. And so this is your two-way opportunity to put in your thoughts and your questions to the BMA on this subject so that they can be fed back to the policymakers. I'm Sharon Alcock and I'm an independent health journalist, and I'm here with Dr. Hamish Meldrum, who's chairman of BMA Council, and also Jon Ford, who's head of the BMA's Health Policy and Economic Research Unit. Gentlemen, can I just start by asking you a question both about how you feel about the white paper and whether you think it is going to improve the NHS and patient care?
I think the jury's still out on that. It's a hugely complex set of proposals, which makes it quite difficult to say whether you're for or against it. There are bits that it's difficult to argue with, like more doctor and patient involvement in the design of services, a greater focus on quality and outcomes rather than just crude targets, more local democracy with the input from local government. But there are other areas, like the continuation with the market in healthcare, like the any willing provider role, that we have huge concerns about. And then there are a whole lot of other areas where we just don't have enough detail, which is one of the reasons why we're trying to stay involved with the process, to critically engage, as we have put it.
Jon, what do you think from your point of view? You're an economist, of course.
I think it's a challenge. I mean, in a document we published some years ago called Rational Way Forward for the Health Service in England, we asked for a maturer form of commissioning involving critically clinicians. And I think the challenge now is for GPs to involve other doctors in cooperation and integration of services, and in so doing mitigating some of the adverse impacts of what's going to potentially be a medical market.
Okay, well, we have got quite a few questions in already, so let's go straight to them so that we can get through as many as we can. Tim Bland, who is a GP, says the King's Fund has questioned the need to embark on such a fundamental reorganisation as the NHS faces up to the biggest financial challenge in its history. Many doctors and nurses would say that a major reorganisation of the NHS at the present time would be detrimental to patients, doctors, communities and the country. Isn't it time that the BMA balloted every doctor in the UK to ask them whether they're broadly in favour or not? And that's also echoed by Dr. Bird, who's a general practitioner.
Well, as I said at the beginning, these are a complex set of proposals, so it's quite difficult to ask doctors, are you in favour or are you against? And also you've got to then ask, well, if you're against, what are we going to do instead? Are we just going to walk away from this? Or are we going to try and stay engaged and make the best out of what is a very complex set of proposals?
But shouldn't you ask anyway?
I would certainly agree that this is not the time, ideally, to be embarking on another major reorganisation, which will be costly, which will take people's eye off the ball. But I think, were we to say to members, we're not going to have anything to do with this, we're going to remove ourselves from it, that wouldn't stop the changes happening. What it would stop is the medical involvement in those changes.
But you are a representative organisation,
yeah.
And Dr. Lucy Algo, for instance, says, what about an extraordinary meeting so that we can at least what we think?
We are reps, and we have lots of ways through our democratic processes of getting members' opinion. All our branch of practice committees are elected. I'm a member of council, which is elected. We have meetings. We get people to feed in information on our website. We give out information through BMA News. I've written twice to the profession about this to get an idea. I'm not sure that a meeting is the best way to devise policy to a very complex set, and actually a changing set of policies that are coming from this government. We have clear policy on quite a few of the issues, like the continuation of the market in healthcare, like the increasing commercialisation of the health service, and therefore I think we're very clear on the stance that we take on these particular issues. I'm also old enough, I'm afraid, to remember the whole fund holding issue and the problems that in many ways created for the BMA, where we had a divided profession, some who wanted to do it, some who didn't. I don't particularly want to repeat that exercise.
But
if
will
at all
you
possible.
ballot members at some point?
If there is an obvious reason and an obvious question, but as I've said, I think a lot of these are not easily answered by a simple yes or no.
I think sometimes the concern is amongst the profession, isn't it, that the BMA doesn't actually represent all of their views, that there is a broad spectrum of views.
With 140,000 doctors, you're never going to be adequately representing all views. But it's a bit like the argument for a government. Do you have a referendum on issues one after the other, or do you actually rely on democratic structures and the fact that you have elected people who you can change to actually help make these decisions? We also have our annual representative meeting, which does create policy on the broad issues. And as I said, it's quite clear what our policy is on quite a number of these particular issues.
Okay, Professor Harry Keane has put in a question in email saying, in the few weeks since he came to office, did the Secretary of State consult with the BMA on the nature of the NHS changes proposed in the White Paper? Did he consult with any medical professional body? Who did he consult with in drawing up these proposals? Can you tell us what the process was that he went through?
Well, I can't tell you all of it because I wasn't an integral part of the process, but Andrew Lansley was Shadow Secretary of State for Health for several years in opposition, and for some time in the government the Conservatives went into the election with the policy that they wanted to hand hard budgets down to GPs, to commission secondary care services. So that aspect of the policy is not new or should not have come as a surprise. Obviously, with the result of the election and the formation of coalition, then some other policies changed, and particularly the issue about local government involvement, more local democracy, local accountability came into play. And I think there was a pretty rapid rush by the coalition government to decide how they were going to deliver their health policy.
Well, how often do you speak to them?
Oh, quite often. I met Andrew Lansley several times when he was in opposition, as I've already met the new Shadow Secretary of State for Health. I've met him and met Andrew Lansley since and spoken to him on several occasions. And I think the BMA does have considerable influence on policy, but it's by no means the only player. He talks to people in the colleges, he talks to other GP organisations, he talks to a wide circle of people, but you know, the BMA still has a reputation for being fairly powerful in these types of discussions.